First of all, congratulations to all those who appeared for NEET PG exams this year. The results are already out and you have got your rankings. Actually, now starts the major difficulty, that is choosing your dream branch. So I am here to guide you in that particular aspect as much as possible. See, first of all, I would like to tell one thing. If you like any particular branch wholeheartedly, please go for it. But if you are in confusion, then you have to consider several factors before choosing the right branch. I will be mainly discussing about clinical branches. First thing will be the interest to read continuously about the subject. See, among clinical branches, many branches require extensive reading. For example, general medicine, pediatrics, radiology, dermatology, all those things. In the sense, non-surgical branches require extensive continuous studying. So you have to have that extra love for continuous studying, and you should be always curious to learn and to get updated yourself if you are choosing these branches. Then what about surgical branches? So here comes the feel good factor. So if you feel good in handling tissues and if you feel good in doing the procedures, irrespective of altered food timings, prolonged standing, and if you are good in teamwork, you can go ahead with surgical branches. Then comes one more important factor, that is economy. So in economy, we can consider three things. There are few branches which will start with low income after completion of post-graduation, and there will be stable income. And if you spend more time in working, you might earn little bit extra, but usually it will be a stagnant, stable income. So in this particular group comes medicine, that is general medicine, pediatrics, and even dermatology. There is second group in which the income will be very much high immediately after the post-graduation, but it will remain the same. This group is dominated mainly by radiology. And the third one is there will be little bit latency in the start of income, but the growth will be exponential. So this type is seen in surgical branches like general surgery, orthopedics, obstetric and gynecology, ophthal, ENT, etc. The next factor is about patient contact. So if you don't want much contact, don't want to communicate that much with the patient and the disease per se, you can choose radiology because there will not be much contact. I don't say there will not be any contact, but it will be comparatively lesser compared to other clinical branches. The second group, where patient communication is a crucial, applies to majority of the branches. And you guys already know the situation in India regarding doctor and patient communication. So this point has to be kept in your mind, and it usually depends on your communication skills, which you can improve gradually during your residency period also. Then comes working hours during residency. So majority of the clinical branches will be hectic. There will be night duties, there will be 24 hours, 36 hours continuous duties in majority of the clinical branches that you might be already knowing and you might have already seen during your internship. But there are some branches which will have little bit moderate hectic works, like you can manage in a moderate degree. For example, radiology. Then comes little bit cooler branches when it comes to working hours. So we can consider dermatology specifically here. So usually there will not be night shifts in majority of the colleges for dermatology residency. So if you are the one who cannot adjust to night shifts, hectic schedules, long working hours, etc., you have to consider those points here itself before choosing the right branch. Because once you choose the branch, you have to adapt to the environment and get adjusted till you complete your course, because you would have got that seat with very much hard work, so you cannot waste it simply like that. That's why working hours should be a primary consideration for residency. Then comes further studies in multiple branches. That means super specialties. So mainly general medicine, general surgery, these subjects have the options of super specialty. So for that, you have to consider the requirements where you want to work, whether the super specialty is needed or not, and your interest as such should be considered. And to avoid being left behind in this competitive world, you can go ahead with super specialties if you take general medicine or general surgery branches. And there are some fellowship courses in almost all clinical branches. So you can do those things. They are always open for majority of the clinical branches. And finally, you have to know about the working environments in India. See, after residency, you can choose with medical colleges. So you can settle down in medical colleges, gradually getting promoted as assistant professor, associate professor, and professor, like that in the sequence. Or you can work in the corporate sectors. And the working environment in corporate sector is entirely different. And few will prefer their own setups, and there are many pros and cons in setting up our own clinical practice also. So these are some working environment currently in India. So these are few things which you will just note down and list out for yourself first. Then you take the help of some of the best seniors. Also discuss with your family members. Don't get confused in multiple advices from numerous people. Just make sure that you are very clear about what you want. So at the end, it should be your own decision to choose your dream branch, because the subject which you are going to choose will last for very long time with you. So that will be your profession in future. So choose it wisely. And if you require any advice regarding selection of branches, you can contact me. I am there to guide you as much as I can. Thank you so much. All the very best for your counseling sessions.